So, sir, we are delighted to have you here, and just your presence is inspiring us, but we look forward to hearing from you.
Thank you, Madhuri ma'am. Good evening, everyone. Thank you so much for coming on a 30th evening, the final month. We have hosted about 99 founders. We were just, taking out the list, and I said the 100th one should be really special. And we've been thinking of it, and suddenly, for the past 1 month, I think our team is trying to put together some names and all of that. Suddenly, we thought we met Nageshwar sir at Times event. If at all he's coming in, then I think I'm done. 2025 is made for me. And then after about 1 week ago, Muskan texted me saying that Dr. Nageshwar Reddy confirmed. I thought, okay, he confirmed for an appointment, probably to the hospital that, we can go and meet you there, probably talk about what we are doing at Bauer. But she said that sir is confirmed to come and do a fireside chat. That's it, my year is done, sir. That was my New Year celebration back then. And it's my privilege to have you in the campus. So far, we have hosted founders, venture capitalists, young founders. We had IAS officers coming in. Today is quite special for us because the kind of achievements that you have done, and it's a big inspiration for all of us across all the generations. Thank you so much once again for coming in. And I wanted to start with, sir, you were born in Visakhapatnam, so that's where I was also born, in Vizag. And then you have done your undergrad, postgrads, everything, one in Kurnool Medical College, then you went to Madras, and then you went to Chandigarh, and then you worked as a professor. And then where did this bug of healthcare entrepreneurship has come to you?
So entrepreneurship, actually, it didn't come as an entrepreneurship. What happened was that I came from a middle-class family. My father was a professor of pathology, very distinguished person. My grandfather was a pathologist also, again very distinguished. My grandfather was a very close friend of Alexander Fleming, who got the Nobel Prize. In fact, when Alexander Fleming came to India, I always stayed in his house. My other grandfather from my father's side was again a very distinguished pathology professor. He was the one who built the JIPMER, Pondicherry Institute of Medical Sciences. My father was already a professor, published huge number of papers. So this was the type of family I came in. Although they were intellectually on a different level, economically they were middle or low middle class. So in Vizag, I was not doing very well in school. I failed my 3rd class. Oh. And the Timpani school used to be there, I don't know. And also I did a lot of things which upset my parents. Like I once wanted to see how petrol works. So I put petrol in the garage and put fire, and the whole house nearly went into fire. I did several things like that. So my parents, my 2 grandfathers and father, all of them were bald like me. The 3 wise men sat around and said, what should we do with this fellow? Because he'll spoil the prestige of the family, We come from society. So he said, we'll try and let him finish his 10th class and then put me into auto shop, They bought a small auto mechanic shop in Vizag, and they said, maybe after I finish my 10th, I can do auto mechanic. So but my acts became so terrible at that stage, they couldn't bear me in the house, so they sent me off to a hostel here in HPS. At that time, Hyderabad Public School was just being transformed in 1963 from it was a Jagidar college, they made into a school. So 1963, I was 7 years old, they just packed me off and said, get rid of this fellow, put him in the school and see what happens. Because the school HPS at that time was a different school, it really transformed me, and then I came out and I did well, subsequently did well. So I finished my PG course in PGH, and again gastroenterology field, which is an unusual field at that time. And then went to Germany, got trained, and then I was in Harvard for some time. Had a good job there, but I wanted to come back here. So I came back and started practice. And when you start at that stage, you have a middle class mentality. Middle class mentality is money, make money. You have a choice. I mean, if you can make, because I came from a very low economic class. I mean, my father was a professor, but he was just having his pay. Then he became a vice chancellor of university, but still he was one of those very strict guys who just had enough money to educate his children, nothing else. So when I came back, I was very hungry because I didn't have a house, I didn't have a car. I also married very unusually from one of my colleagues in the college, a different religion, everybody is against it, so I had to support myself to fight against all that. So with all this, I had to make money to show people that, okay, I'm comfortable. So I started to practice here in a place called Medina. I came to Nizam's and then resigned, start practice. I had a huge practice because I was only 4 people in the country at that time were doing all this endoscopic surgery. I was trained in Germany, so I was, my main goal was, okay, do your good medicine, but also make a lot of money. So I was making 4 years into practice, huge money. I thought I was a very successful doctor. You know, doctor's success usually measured by lay people and the families, how much money this doctor is making, not by other things. So this was happening, and then about 4 years into practice, my dad called me into his house one day and told me, son, you're a big disappointment. You're a big failure in life. I was shocked. I said, what do you mean? I went to the best schools, medical school. At that time when I went into the Chandigarh PGI, there was only one seat for the whole country. And a lot of people competing. I competed, got that seat, did. I went to Germany, one of the best institutes, got trained in surgery. Then I went to Harvard, where I was actually offered a professor post. I gave it up and came here. And now I'm making a lot of money. Family is happy. What do you mean failure? He said, success is not this. Success is not what you make money. Success is, have you built institutions? Have you taught students? Have you done any research? Have you given back to the society? What have you done? And when I look back, all the 4 things are 0. I hadn't published any papers. My father had 300 papers already at that time. And I was not teaching any students. I was just busy making money, afraid of the income tax guy when he'll come in and all. That was the situation. So when he said this, it struck me that there's something wrong in my life. So I said, okay, I'll change goal now. I'll get into a salaried format, build an institution, get good people together. So when this happened, something very strange that this was in 1994, many years, 30 years back. But at that time, I had money, were comfortable, but not enough money to make a hospital. You know, I was just basic to live well. So I was wondering, my colleague was there, Dr. G.V. Rao, who's been with me all along, he's a surgeon also. So we decided, okay, we'll start but how do we start a hospital? We don't have money. I didn't even know how to pronounce entrepreneurship. That is a new word to me. I didn't even know about it. So how do you start? So something very serendipity. I think there's a lot of serendipity in when you build institutions, when you go in life. You know, one of the things that happened was, at that point of time, the Chief Minister of Karnataka was Mr. Krishna. He was the chief, S.M. Krishna. So his wife had a surgery done in Bangalore, a major surgery. And unfortunately, when complication of surgery was there, that the stone got stuck in the liver. They were trying to remove it, they couldn't remove the stone through endoscopy. So he rang up to a big doctor in London and said, can you fly down immediately? My wife is very sick, she's dying. She requires this endoscopy. The doctor said, it takes me 10 hours to fly from London, but I know a guy in Hyderabad who can do it, why don't you? This was a famous professor in London. He knew me, so I got a phone call at 12 o'clock in the night from Mr. Krishna saying, I'm Mr. Krishna, Chief Minister of Karnataka. I want an urgent concern. I thought you were joking. I put down the phone because no Chief Minister rings up to a small guy practicing in Hyderabad. And I put down, again he rang up. He said, look, I'm serious. I'm Mr. Krishna. My wife is very serious. I heard you're the only guy in the country who can do this surgery to remove the stone. And then I realized it was serious. So he sent his private jet there. It was a Vijay Mallya jet actually that time. He sent it here. So I took my instruments and then went and then landed in Bangalore. I landed at 1 o'clock in the morning in Bangalore. And I was driven to this hospital, this called the Mallya Hospital at that time. I went into the hospital and saw his wife was like gasping. She had no pulse, she had no BP. She would have been dead in another 10, 15 minutes. And as soon as I went into the hospital, all around the hospital there were all these gundas, political gundas with khadi shirts and standing there. So the first thing I asked the director of the hospital is, something happens, how do I go out in another way? So he showed me an emergency exit in the backside. So I was ready to go if something happens. But then I took her into the theater and I was very fortunate that very quickly, within 10 minutes, I could do the surgery and take out the stone. Now this lady who was about to die, once the stone, pus, everything came out, In the morning, 6 o'clock, Mr. Krishna came expecting that sad, bad news that nothing could be done. He saw us sitting down and eating breakfast. So he got terribly impressed. He said, if this is the kind of technology, we should have it in bank. He called the revenue secretary, he called everybody, he called, come and kindly see that this doctor is given the land, start this gastroenterology institute, we want to have it in Bangalore. I told him, look, I'm thankful, but I came back all the way from Harvard just to be in Hyderabad to develop it there. So I'd like to go back, can you help me? So he said, okay, I'll help you. This old building we started in, so much good, I must have seen though. It's old, like an old castle it is. One of his chelas was building a hotel there, almost completed. He called him and said, give this off to these doctors. So we got the first hospital more like a donation, So it was a 200-bedded hospital, 200-bed hospital. It was actually the only single gastroenterology specialty hospital in the country. So when you start a single hospital, I managed to get people together, similar-minded people who wanted to do research, who wanted to do service, who wanted to do ethical clinical practice, about 30 of them together, medical, surgical, and this institute came within 4 years. It became extremely busy, 4-5 years time. So at that point of time, Mr. Nageshwar Reddy, who was then the CM, came for a checkup to the hospital. Now, when you come to the hospital, the lobby used to get so full that people are not allowed to go in unless they had a token or something. So this man, CM, he thought he can just walk in. He was trying to walk in, but people shouted, blocked him, said, why are you coming? We are there already. Because they didn't recognize immediately, because most of the patients were from other parts of the country. Then he came and said, what are you people doing here? He said, I'll give you 10 acres of land in Gachibowli. Can you make the world's best hospital? I said, I don't know about the world's best. I can make the best gastroenterology setup in the world. So he gave, that's how we got this 10 acres of land at a very low price. Again, serendipity, it was very lucky. And so we built this Gachibowli hospital here, 1,000-bedded, and fortunate that there are also very good group of doctors who joined us from different specialties. So it became multi-specialty, not only gastroenterology, cardiology. So we have the best people in each specialty coming in from different parts of the world joining us. And from 2022 to 2025, the Newsweek has labeled it as one of the best hospitals in the world. So we have he told me jokingly, I thought he was joking, but when you build such a big thing, you require to know something about how to manage money, entrepreneurship. I knew nothing, zero. I'm basically a medical person who looks after patients, does endoscopic surgery. I don't know anything about money, managing money, because in medical schools they don't teach us they don't teach us two important things, which I realize now looking back, which maybe you should take up with medical. One is how to manage people and how to manage money. Either more money or less money, whatever it is, and how to manage. We never taught anything in medical school. We just taught see patients, how to treat patients. So when this big challenge came, naturally we required partners to help us build this, and you have all these equity guys and all. Equity guys, terrible word there. All the VCs, actually I call them vulture capitalists. So they're all the time looking at praise, which person to catch so they can put in. And so the first guy asked me, what is your EBITDA? I said, I didn't even hear about this word before. What is your RPOP, that is revenue per occupied bed? What is your ALOS, average length of stay? I never even knew these words at all. He told me, do you know how much you can borrow to build a hospital? What content should be the salaries? What should be, how much revenue you should make to break even? I knew absolutely nothing, zero. I just started it. Over the last 5 years, I learned all these things, So it was, I call myself an accidental entrepreneur. It is just a big accident that happened. Series of accidents. I was forced to learn this. So now, actually, I'm actually the creator for we have a central body now in Delhi, which looks after hospitals and all that. And it used to be Medical Council of MCI earlier, now it's changed. So now I'm suggesting that in all medical colleges, you have to have a course where you teach at least for 1 month or 15 days these things, entrepreneurship, how to manage money. If you want, so we don't have this at all. None of the doctors, even now coming after college, knows anything about this. I'm sure even the term entrepreneurship they can't pronounce because it's such a new thing for us. So this is a big deficiency which I believe very strongly now after building this institution, that we should inculcate in the doctors how they can develop institutions. Because the problem, I'll tell you, one of the biggest problem now in India is that most of the big corporate hospitals are owned by non-doctors. Very few are owned by run by doctors, and those which are run by doctors also, doctors who have become non-doctor corporate people. They've lost their skill. Actively practicing doctors run small nursing homes, run small clinics, but not big corporate hospitals. So this is a problem because only doctors who are actively practicing can actually do justice to creating good medical systems where patients are treated ethically, where latest scientific thing is brought inside without looking at, okay, I buy this machine, it costs so much, how much is the returns on this machine? That is something that should not be done, but all corporates, all equity guys look at this. If I say I want to buy a new scan, they'll say, okay, this scan is costing 10 crores, how much can you make every month on this? This is absolutely wrong. Only doctors who are seeing patients can understand the value of this, that over a period of time things come. Of course, we have to make returns to get back the money to run the institutions, but it should not be 1:1 on each scan. So that's the reason I believe that in India now, the time has come where doctors, and we're getting these types of doctors who are passing out, surgeons, orthopedic surgeons, heart surgeons, who all want to run their own places but are not empowered to do that because they don't have this knowledge. So it's very important. And after going through this journey now, I realize so much that was lacking in me. I was extremely lucky that we came to this stage. At any point of time, we could have been finished, but I had a lot of luck with me.
Okay. Thank you for sharing the journey, sir. I wanted to keep the session very interactive, so probably we will start with Mr. Kishore. So he runs something called SIDS Farm.
So what's that, Kishore?
So in a medical emergency, absolutely, you have to treat an animal, but we make sure we test. We test for 5 different antibiotics every day. Tetracyclines, beta-lactams, sulfonamides, streptomycin, and chlorophenicol. We test for it every single day. Run an average of 10,000 tests daily to deliver milk without any. We charge more to our customers, but
but that's important because I'll tell you why it's important. Recently, we published a big article in Lancet where we found that 80% of people who are coming to us for endoscope procedures, when we tested, they had in their gut organisms which are resistant to all antibiotics.
Absolutely, sir.
And these people said, we didn't even, this is a hospital, we didn't take antibiotics. How did you get? They got it from milk, they got it from poultry, they got it from even vegetables they're getting now. So when we put this paper up, the government is very upset with us. A lot of phone calls from Prime Minister's always saying, how can it be, how can it be? I said, that's how it is, because this is a very, very, I think it's a good thing you're doing, because we require that type of
Absolutely, sir. So see, typically, usually when we put it out, right, see, we write boldly on our packets that it is antibiotic-free milk.
But I don't know how much public is, recognizing that. Do public appreciate that?
Sir, today around, in Hyderabad, about 50,000 people consume our milk. So I'm saying slowly we are able to.
That's very
But it is a 13-year-old journey, for us. So one question I wanted to ask you. Maybe I'll ask you in Telugu for effect. I'll translate it later. Sir, anta pedda hospital kadtunte bhayame leda, sir. I mean, the beautiful anpichindi naaku. I didn't know this story. I thought you were a rich guy who had a lot of money. That's why you built such a beautiful hospital. But as you were talking about this, and naaku anpistindi,
when I started practice, initially first low, I came with 35,000 rupees from Chandigarh to start. I had only that in the bank. It's still okay money at 1984. 10th patient I saw was a politician who said, I'm competing in Eluru election undi. Can you lend me whatever you have so that I'll give it back immediately after election. So the first mistake was I wrote out a check 30,000, so I had only 5,000 bank. For 5,000 rupees in the bank. So 30,000 rupees, he never came back again. So then I realized one of the things is never to lend money to a patient, because not only they take it, but they don't come back also. Your business also goes down. So this happened. So then I realized, and when we're building this, chala bhayamesindi cheppinadu. But what do you lose? Maximum is you lose everything. But then you still have your professional career to start again, restart again. So I think a failure like that is never a failure. It's like they always say a stepping stone, but a failure can be a very good lesson for a success story. So there were small failures in between, like some contractors cheating and so on, but you learn from these stories. So I think without taking a risk in life, you can never get to a stage. I started with 5,000 rupees. Now our hospital setup is valued at 3 billion rupees. So $3 billion, that is 30,000 rupees. Crores. So, of course, we share among all the doctors. But still, what I'm trying to say is that one should be never afraid of taking a risk. If you don't take a risk, you'll never do well. The only important thing is one should take what is called a reasonable risk. That is, with the risk should not be so great that you throw your family into streets and all that type of thing. You should take a reasonable risk to get an achievable target. Again, target should not be, I should not think that I'll become Apollo Hospital of India. It cannot, because that's come over so many years, so much. So it has to be an achievable target. So these two things are reasonable risk and achievable targets are two important words I learned in this. Yes.
Good evening, sir. My name is Sudhakar Rao. I am from ICFI Group of Educational Institutions.
Yeah.
We are 40-year-old this year.
Yeah,
Our founder was on the board of Apollo Hospitals. Sir, whenever we think of you, it's not a new name. So whenever we think of you, what comes to my mind is someone, a doctor who has institutionalized excellence, not episodic brilliance or something like that. If a young entrepreneur in this country today aspires to build a healthcare institution like yours, which can last for 30, 40 years and more, most probably that young entrepreneur could be from this room, from Bauer School of Entrepreneurship. What is the one mistake that you would warn him or her against?
Not to do, you mean?
Yeah.
Yeah. So I think one mistake anybody who is building a medical institution should not do is to look at money numbers. So you're driven by graphs like this, this month, this month, this month. We should never look at money numbers because in medicine, it's a very slow process. The initial part, actually the graph is always straight because you have to look at three things. You have to look at excellence in healthcare. You should look at very ethical healthcare, very important. And third is academics. These three, so if you maintain ethical, academical, research-oriented institution, this graph which is straight will grow sometime. And when it grows, it really grows higher because society values these things. And we as doctors are doctors in a hurry, don't realize that you should take this time. It is not like other businesses where, software business where 1 month this, next month. It doesn't go like that. So a doctor who's starting these institutions should never look at numbers and have the patience to wait for things to happen.
Thank you so much, sir.
My name is Sapna and I head data and AI at Microsoft. First of all, huge respect for this profession. Being an IT professional myself, I feel it's such a relatively easier journey. 4 years, you start earning decent, versus in a medicine where you have so many years, then you do super specialization. So I have multiple questions and thoughts going in my head. First is, you mentioned that you're talking to MCI about entrepreneurship for doctors, because it's extremely important that rather than corporate, doctors run the healthcare. But at the same time, the residents, the working hours, for pilots we are talking about having regularized working hours, but that's not the case for doctors. So anything in that space, that's question number one. Second is if someone is since you mentioned that you would advocate for having entrepreneurship as a course in PG or I don't know, whatever residency, what would be your advice for someone, let's say, taking a PG in, I'm just picking a random stream like Dermat right now? And the third question, because I come from AI space, how would you, because I don't know whether the curriculum are advancing at the same pace, how would you think about AI in healthcare? So 3 questions.
So usually it's best to start with the last question before you do. So AI is very important. AI is becoming, in fact, we are the first hospital in India to have a separate department of artificial intelligence. So we have cardiology department, gastroenterology department, we have a department of artificial intelligence with a faculty heading it. Mr. Kinjal Saxena, who's just come off from Google, has joined us. So we have 40 engineers, full-time 40 AI engineers in the hospital.
Awesome.
It's worth visiting because we've done a lot of things. We have, in fact, the problem with AI in hospital setup is extremely expensive. AI engineers are more expensive than doctors. The pay is more, one. Number two, is that the amount of power it consumes is more. The AI department is consuming more power than MRI scans or CT scans. So all that I learned after starting it in a hard way. But anyway, it's very exciting because we found that in fact, this is a whole new 1-hour talk on that we can discuss later, but we found that ultimately it pays back. AI is extremely useful in running hospitals and even in healthcare in deciding certain things in patients. I'll give you a small example. I hope I'm not taking too much of it. And the example is this, that we have what is called code blue in the hospital. Every day, we have a code blue which they announce. The code blue team says this patient has crashed, kindly rush. So we have a team of 6 people, cardiologists, internal medicine, everybody ready with a big trolley. As soon as code blue is called, he rushes there. And then the patient is revived. Out of the 6 code blues, 2 patients we can't revive. They die in the hospital, admitted, because there's so many serious people in the hospital. Only 4 we can survive. So what we did is we used the AI algorithm, LLM, to create a system where patients in the hospital have 6 parameters. If they reach abnormality in the 4 parameters or we set certain marks, immediately the medical emergency team is alerted. And they go, patient has low blood pressure, oxygen saturation is low, or one of those things, correct it immediately. After we started this system for intensive care, we have now had no code blue calls in the last 6 months. And that means not only that we are saving this, but every day we are saying 2 patients in the hospital trying. So this is just an example. So this is AI. So I think AI is a must. Every hospital must adapt it in a certain way which is useful. The second thing is regarding the MCI and the courses. I think these courses should be introduced in the undergraduate, because undergraduates are quite mature enough to take this and go. Because many of the doctors after MBBS, there are people now going to ISB or even this administrative staff college to do courses there afterwards. So we should start in the middle college. I'm not seeing any reason why, because we're not starting because all our administrators are old-fashioned. They're all very, very, retrograde thinking. That's a problem. So we have to try and see that it comes into the course. And for example, like dermatology is such an exciting field now. Exciting. Also, my wife is a dermatologist. So dermatology is a very exciting field because a lot of aesthetic surgery, new types of dermatology, lasers, so many things are happening. So one actually can become a huge entrepreneur if he starts a good dermatology unit which is looking after all these things. So I think every undergraduate course, they should make it compulsory that you have. See, I'm not sure, Pawan, you may tell me, does it take more than 15 days to give you the basics of entrepreneurship?
Not at all, sir.
Yeah, so 15 days is not much in a middle college. They should have their own training. But once they're trained, it's not so difficult you can run. For example, I didn't know how much salaries we should pay to our staff to make break even. And I came to know that in a hospital like ours, it should be only 26%. If it is more than that, you can't run the place. I came to know hard way after starting this. So simple things like this, you can teach very easily to the doctor.
I think this will be on the vision board of our New Year's to start
So you could actually, I don't know whether this could be possible, that you could even talk to the state government and say, okay, the Bhavas Institute wants to teach entrepreneurship to students in, say, 6 medical colleges here and so on, a 15-day course. And they could go and teach the course, and they can have some sort of a financial arrangement with it.
I think that's a great idea.
Sir, thank you so much for coming, spending time with all of us and sharing your insights.